I think I'll tell you the story of my life.
Tell me.
Before that, social worker must know ethical dilemma, know the limits, scope of confidentiality, and therapeutic relationship between therapists and clients. And social worker also need to know value of social worker, service, social justice, dignity and worth of the person, importance of human relationship, integrity and competence. Firstly, the needs of vulnerable client. Clinical social worker must know the needs of the clients. To know the needs of the client, clinical social worker should know social problems faced by client. Report is important to get insight on client's problems. For example, referred client. Doctor claim that client need money without knowing client's background. And no further investigations. Secondly, organize clients and colleagues to inform key participants in managed care of the risk. Clinical social worker must make sure client receive the service given. For example, clinical social worker manage discharged client that have stroke and need to use wheelchair. Clinical social worker must educate family how to manage care for the client. They also must organize to avoid further burden to themselves and help caregiver about care management of the client. Thirdly, the severity of mental health problems left that are not addressed. For example, doctor realized and didn't manage to investigate further. So, clinical social worker need to investigate client's history of mental illness. Lastly, the benefits of high-quality services. Clients can be helped. Clinical social worker can fulfill client needs. No future problems and doubts to clinical social worker. And to avoid clinical social workers' violation of ethics. Self-disclosure. Should social workers disclose personal information about themselves to clients? How much personal information is appropriate to share with clients? Are there times when self-disclosure is unavoidable, and if so, how should this be handled? What is the impact of self-disclosure on the social worker-client relationship? For this, clinical social worker can disclose personal info to client to maintain professionalism. Clinical social worker must know limitation and appropriate amount of info that the client should know to differ clinical social worker from the client. Clinical social worker also should not share personal number to client. Secondly, privacy and confidentiality. How should social worker respond when a client sends them an email with personal information? Who should have access to client information? Is it ethically appropriate for social workers to post non-identifying client information on social media platforms? Actually, only clinical social worker who handles the client case can have access to client's record and report files. Social Learning Theory by Albert Bandura. Behavior is acquired by observing others or events by watching, listening, or reading. This theory uses three-way interactions, which is among behavior, the external environment, and internal events including cognition. The environment affects individual behavior. For this case, clinical social worker can use the principle of social learning theory in their practice by modeling pro-social behaviors to the client.